CO2 laser versus series of microdermabrasion peels. Hi, I'm 44 and have been told by a few dermatologists that CO2 laser would work wonders for wrinkles, skin tightening, but wanted to find out if there is a less invasive option, like maybe a series of weekly microdermabrasion and/or peels that could do the same thing but over a longer time. My hesitation is, in the past, I had way too aggressive IPL that caused facial fat loss, and I'm afraid of that happening again because laser heats up. I'm wondering if that's my only option. Thank you.
Thank you for your question. You're 44 years old and you have consulted several dermatologists about helping the fine lines and wrinkles, and you've been advised that CO2 laser will, quote, work wonders for you. But you have a couple of concerns, including the prolonged healing process and whether comparable results could be accomplished with microdermabrasion and peels. And you've also expressed a concern of the loss of facial fat from the use of heat. Well, certainly I can give you a lot of guidance with this type of question, although there's no photo submitted in the absence of a physical exam. But I can share with you my experience and how I counsel my patients. I'm a board-certified cosmetic surgeon and a fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. My experience with lasers begins first with chemical peels and then started in the mid-90s with the original CO2 lasers. I have several different lasers in my practice, and I offer a wide variety of solutions to help people like yourself. So to help you understand a little bit of the science of why the dermatologists are sharing with you this enthusiasm for the CO2 laser, you have to kind of understand that prior to the CO2 laser, the gold standard was always chemical peels, and still chemical peels is the gold standard by which lasers are compared. There's a difference, however. The biggest difference is with chemical peels, whether it's superficial, medium, or deep chemical peels, it's about ablation of a certain level of skin and the body generating new skin with a certain amount of collagen that is greater than what was there previously, and improvement of texture, skin quality, and color. Okay, so now that being said, when lasers came along, there was one more thing that could happen that was better when compared to the chemical peels, and that was tightening. And the tightening effect of thermal energy has resulted in a almost infinite variety of technologies that have propagated since the mid-90s, and certainly consumers are overwhelmed by every year the greatest laser, the greatest radiofrequency device since the last greatest laser and radiofrequency device. So it's understandable. In fact, we see a lot of patients who basically bought into one of the more popular radiofrequency devices and who have experienced exactly what you're afraid of. They experience fat loss. Basically, what was once very aggressively hyped turned out to be a procedure that was extremely painful and caused a lot of fat loss. So to help these patients, we've actually been doing PRP injections, and we've been trying to work on helping them get back some tissue volume. So when we look at what can help someone like yourself, you have to understand that if you do light peels or microdermabrasion, you can only go so deep, and you're not going to get the collagen response you want with or without thermal energy. So in our practice to help patients like yourself who is hesitant about the level of thermal energy as well as the downtime associated with fractional CO2, which I'll tell you that the fractional version of CO2 laser and the science has advanced significantly, and the amount of redness and prolonged healing is considerably less than what we experienced in the 90s. Now, that being said, we actually have a device in our practice. It's a it's a Fotona Dynamis laser, and it's a combination technology of erbium and ND or neodymium Yag technology. What this company did was they figured out what is the closest that one can get to the gold standard of CO2, but at the same time minimize the downtime of the patient, as well as carefully manage the amount of thermal energy. That we do use this device not only for resurfacing, for wrinkle treatment, but we also use it for non-surgical fat reduction. And it's unique in that we're able to actually apply the heat in a very specific way and still protect the skin very effectively. So certainly there can be a program where you get the benefit of thermal delivery up to a point, but limit it so you don't have heat transfer to the fat and still get the benefit of CO2 or fractional type of laser benefit, which would be better than microdermabrasion and light chemical peels. And the way we do this is we'll have a patient come in for one procedure. They'll typically heal or reepithelialize in 24, 48 hours, and then they'll come back in 2 weeks to a month for another treatment. You know, cosmetic dermatology or cosmetic laser treatment, sometimes, more often than not, is about treatment and observation. So certainly you do have other options, but get some realistic understanding from the doctors about what to expect. I know that for myself with fractional CO2 laser, I do, even when people have deeper lines, I tend to kind of dial it back a little bit because I want them to heal faster. In the modern world, people don't have time. And because collagen remodeling goes on for months to a year, they can actually continuously see improvement. So clearly there is more than one way to address fine lines, wrinkles, and skin tightening. So finding a doctor that you can trust and you feel gets what your concern is and can assure you that fat volume loss is not likely, I think is the key to your journey. And hopefully you'll be able to make this distinction. A lot of times doctors advocate lasers they own for a variety of reasons, including which they felt at the time when they got this laser that this was the best thing. And I think everyone goes in with the best intentions in mind. But when you have a variety of options, then the doctor, like a surgeon who can do many things, can offer you different options. And that's what we do in our practice. We have everything from minimally invasive to very aggressive technologies as well as procedures. So take this information and use it to help you find a doctor that you'll be comfortable with. So I hope that was helpful. I wish you the best of luck, and thank you for your question.